Nasolabial folds. Can I have an unprimed needle on that? I'll take a 27. Nasolabial folds. Everybody hates these lines. Nasolabial, you hate these lines.
Yeah.
Everybody hates these lines. So she has a crease and a fold. A fold is a more delicate, wider kind of crevice. A crease is what we see here. Fixed two different ways. So, just keep checking this. This is real life, right? I'm not concerned about that at all. Okay. So to fix this, I'm going to go down onto bone. This is a very tender injection. I'm hoping that I can do a good job for her, not hurt her. Very nice. I'm down on bone. I tapped here. I went straight in. And now, aspiration technique. This is extremely important. Aspirating can either be worth your time or a waste of time. So, I have this down on bone. This needle is down on bone. I now am supporting that syringe with my left hand. You could not pull that out of my hand if you tried. Now I'm going to use my right hand to pull back, and I'm watching the hub of the needle. I don't think I'm in a vessel because A, I don't feel anything other than hard bone. B, she didn't jump. And C, I'm holding this very trustworthy aspiration because my syringe has not moved. I'm now going to let go, and then I'm going to inject. And I'm going to lift my left finger, and I'm going to watch her nose. I'm going to watch her forehead, and I'm going to slowly withdraw. Great. Okay, there's two ways to fix a nasolabial crease. This is different than a fold. I have a fold. This is a gradual indentation going from the nose to the jawline. A crease is different. A crease is when there's actually literally a fold in the skin. So there's a couple ways. We support it at the piriform. You just saw that. And then I'm going to come and go this way. I'm going to go drop in, I'm going to drop down, and I'm going to stay in the upper layers of the tissue. I'm not going to go deep. Her angular artery's in here. If you do not feel comfortable with this technique, please use a cannula, or you can try this other technique that I'm about to show you. I'm watching the corner of the mouth. Do we have one with a 30? I know, I just had you change it. I'm sorry, Lauren. So this other technique to fix the crease is exactly what I did down here. If you're not comfortable coming up like this after you've supported the piriform, or if you're not comfortable with a cannula, you can do small little struts, again, perpendicular, because the vessel runs up like this and splits. I am just going to go perpendicular, and this is actually a bad angle for me, but that's okay. We'll make it work. And remember, this technique will bruise more, but man, does it work beautifully. Little tiny struts just underneath the tissue across here. More than one way to skin a cat. There is not one true way. Your way is fine, as long as it's safe and you're thinking about what you're doing to the tissue. So that's a nice way to help that there. The other technique would be a ferning technique, which is made famous by a wonderful doctor, Dr. Tom van Eyck from the Netherlands. He was smart enough to trademark and patent that, where ferning is just little tiny, tiny, tiny injections on either side of the crease, and then he would come this side and lift. And normally you do it from either side of the patient, but I'm just doing it to show you quickly. And then over time, that blends together, and he'll do an entire face like that. This is a beautiful technique. I will give him credit for that. It is lovely. A lot of us have been doing that type of technique for a long time, but that is the name of that. And you can Google that and see him do ferning technique. That's another way to hit the crease. And now my last part on this side, I'll take a 27. Do two more things. This is an unprimed needle, so there is no filler in the hub of this needle. So it's safe to say that I'm going to get a true aspiration. So we're going to do a little bit of support. Her brow naturally comes over and down. A lot of women actually have this shaped brow where it comes down like this. Everybody loves a little bit of an arch. Do you love an arch? I love an arch. So I'm going to find her temporal fusion line. This is a big landmark in aesthetics. I'm going to put my finger right on it. I'm going to pull it up and hopefully just guide the vessel up this way. And I am going to go straight in. Did that hurt? No. I'm going to tap. I'm then going to do the same aspiration technique. My left hand is so important. I'm going to hold that steady. I'm not moving. And then I'm going to pull. 5, 4, 3, 2, 1. I'm not moving that needle at all. I'm going to let go gently here. Slow and steady. I'm bracing my hand. Again, watching the area around. Watching the hub, watching all of that. Small, steady bolus here. And I'm going to just support that and let it go gently. Not a drop of blood, but look at that nice little improvement that we get to round the outside edge of the brow. So it just softens the look there. The last thing we're going to do here is I'm going to just add a little bit of definition at her chin. I don't want to give her a pointy chin like that because it doesn't really go with her face. But I do want to give her a little bit of definition and support the dermis here. As we lose structure of the dermis, it starts to get crepey, and then we add the mentalis. Pout your chin for me, like pout your bottom lip. We add this mentalis, this very strong muscle, and it then furthers the aged look of the chin. Relax. So I'm just going to do a little bit of supportive filler here. 27 gauge needle down on bone, tapping. If you want to aspirate here, again, 5, 4, 3, 2, 1. Slow, steady. My hand is bracing on my other hand, so I know I can trust that aspiration. I'm watching her lip. I'm watching the area around the injection site. And then lastly, I'm putting a fair amount in here. I put like 0.4 in there. Stick your tongue out, all the way out. I'm looking for any changes. Stick it out, lift it up. Good. And I'm looking for any changes at the gingiva, of the base of the tongue, or the superior part of the tongue, the anterior part of the tongue. So that way we can tell if we've hit any of that. Look at that nice difference of that. Let me look at your face one time. She has a tiny deficit. Smile for me. Tiny deficit right here. I'm just going to waste the rest of this product down on bone there. This is the artistic last little touch of that side. And this side is completely restored from top to bottom.